Hello everyone. In this video, I will be discussing on the topic idiopathic thrombocytopenic purpura. In this video, we will discuss with the types and the clinical features. Immune thrombocytopenic purpura or idiopathic thrombocytopenic purpura. It is the most common form of thrombocytopenia as well as common form of immune thrombocytopenia. In ITP, there is increased destruction of platelets. I repeat, increased destruction of platelets by immune mechanisms and mainly by autoimmune mechanism. Hence, also referred to as autoimmune thrombocytopenia. Hence, ITP is also known as primary immune thrombocytopenic purpura or autoimmune thrombocytopenic purpura. It is defined as an isolated thrombocytopenia with normal bone marrow in the absence of other causes of thrombocytopenia. And ITP has two distinct clinical syndromes manifesting as an acute condition in children and chronic conditions in adults. So what are the types of ITP? There are two major subtypes of primary ITP, acute and chronic. Both are autoimmune disorders in which platelet destruction results from the formation of antiplatelet autoantibodies. So, first one is acute immune thrombocytopenic purpura. Acute ITP, it is a self-limited disease of children between 2 to 4 years and occurs with equal frequency in both the sexes, and it often presents 1 to 3 weeks after viral infection, usually measles, rubella and EBV infection. And the platelet destruction is caused by antiplatelet autoantibodies, and these are IgM type of antibodies that combine with the platelets and result in destruction of platelet in the spleen. So at the end of this video, I will be discussing on the pathogenesis of ITP. So in ITP, platelet count is decreased and sometimes even below 10,000 to 10,000 per cubic mm. Now let's discuss the clinical features. The onset of thrombocytopenia is abrupt or sudden with petechiae, that is red patches over the skin, but do not mix up with the purpura. Purpura and petechiae, they are different. Petechiae will be smaller and purpura will be quite big. So as you can see in the picture, this is petechiae, they are small red spots, and purpura, they are bigger in size. So the onset of thrombocytopenia is abrupt or sudden with petechiae over the skin, gum bleeding, epistaxis, that is nose bleeding, and mild fever, which usually resolves spontaneously within 6 months. So steroid therapy is indicated only if thrombocytopenia is severe. And approximately 20% of the children, usually those without a viral prodrome, have persistent low platelet counts beyond 6 months, similar to that of chronic ITP. Now let us discuss chronic ITP, chronic immune thrombocytopenic purpura. Chronic ITP is defined as persistent thrombocytopenia. I repeat, persistent thrombocytopenia that lasts more than 6 to 12 months. 6 to 12 months, and this is an indolent and more common form of primary ITP, and this is usually seen more in adults. I hope you have understood. In the next videos, we will be discussing with the pathogenesis. Thank you.